Sure. I think there are several things that a pediatrician can consider. I always ask about current stressful situations and mental health as standard practice because we know that these conditions are so highly linked to gastrointestinal symptoms. But as part of that discussion, I'll also talk about how the gut and brain not only interact right now at the current time, but during all parts of your life. So from birth onward, but probably even earlier, because it's something that can make a difference in how your gastrointestinal and mood conditions are potentially treated. And so usually patients and families understand that. So as a gastroenterologist, I focus on the gut first and then go on to discuss the integral nature of the gut-brain connection, the idea that the gut and brain communicate 24 hours a day, 7 days a week, and that the gut talks to the brain as much as the brain talks to the gut. So if one is impacted, it's highly likely that the other one will be impacted too. I think another idea potentially is to incorporate a standard screen like the Adverse Childhood Events Questionnaire or the ACE-Q. And that's a 10-item self-report measure that's designed to retrospectively assess exposure to potentially traumatic experiences from birth to 18 years of age. It's a quick screen and it's validated. So it's something that if you use standardly, it can just be incorporated in routinely. Sure. So I think putting this all together, that the message here is that maternal mental health conditions need to be treated because even though there are potential interactions between antidepressants like SSRIs and gut-brain axis development, we actually saw more with untreated maternal health conditions. And we also know that untreated maternal health conditions may not only affect the baby, but can also have a significant impact on the mom, which is a really critical consideration. And I also want to emphasize that this need not be medications in every case. For some pregnant women, even exercise, sleep hygiene, stress relief, healthy eating, and therapy can help. In fact, all of those things should be considered as a part of treatment. But of course, if a pregnant person needs medications, I wholly support that as well. So I think that understanding the mechanisms underlying how early life stressors contribute to how the gut-brain axis develops and communicates is still in its infancy. So in fact, this is a seminal paper in describing some of those potential pathways. But having said that, I think there are applications that can be applied to practice now. For example, the sympathetic nervous system was shown to impact how the gut moves, gut motility. And so that manifested in our animal models as constipation or diarrhea. And it's already known that anxiety can cause the sympathetic nervous system to become hyperactivated. And we also know that anxiety is highly comorbid with disorders of gut-brain interaction. So perhaps treating anxiety with or without gastrointestinal meds should be an additional consideration in cases like this. And I consider that in my practice routinely. But I also think more broadly, what this paper shows, I think mechanistically and clinically, and that also other clinical studies have demonstrated, is that early life stressors or adverse childhood events are significantly linked to long-term issues with disorders of gut-brain interaction and mood disorders. So when patients come into my office with either of these symptoms, it's important to evaluate not only for acute stressors, but to go back in history as well and evaluate for early life challenges. And I think finally, another point to make is that because gut-brain communication is constant and gut and brain conditions are so tightly linked, that when one system doesn't function optimally, then the other may not. So when patients come in with gastrointestinal symptoms, I think it's important to ask about mental health, and the opposite's also true. That if someone comes in with mental health issues, I think it's also important to ask about gut symptoms because treating one may also help the other. So I think this is a great question because many serotonin-based medications have relatively low efficacy rates for both disorders of gut-brain interaction and even mood disorders. And so this is actually a key area that we're currently studying in the lab and an area in which we have developed and are currently developing novel drug targets, but these aren't ready for prime time yet. So what I'd say is there are other medications that people use to treat disorders of gut-brain interaction. So if patients are having these conditions, it's important to go to a doctor who understands how to treat them. And as I said earlier, advising lifestyle modifications like good sleep, hygiene, dietary guidelines, exercise, and other forms of stress control are also key. Sure. So the amazing thing about the nervous systems that are not only in the brain, but also in the gut is that they're plastic. So what that means is that even if development is different because of early life stressors, nerve cell connections and communication can be altered in beneficial ways through a lot of the ideas we already discussed, like the lifestyle modifications. Good therapy has shown success in both disorders of gut-brain interaction and mood disorders, and may also be needed to uncover and process trauma, particularly if it occurred in earlier life. And of course, some people need medications, and I support that as well.